Today I'm going to talk about diabetic neuropathy and what you need to know. But first I need to go over a few disclaimers. The following information is not intended to diagnose, treat, cure, or prevent any specific diseases or medical conditions. Please consult a licensed healthcare practitioner before beginning any natural, conventional, or functional medicine treatments or protocols. By using this site, you understand and agree nothing here is to be construed as personal medical treatment advice and is not a substitute for professional medical care. The FDA has not approved or evaluated the information on this site. And my financial disclosure or disclaimer is that I consult nationally and internationally on chronic pain as well as neuropathy, and I do have interest in a supplement store. So diabetic neuropathy. This is the most common type of neuropathy. In fact, 60 to 70% of people with diabetes have neuropathy. And neuropathy can present in a lot of different ways. Oftentimes it begins with a burning, tingling sensation, perhaps numbness and increased sensitivity in between the toes around the feet. Diabetic neuropathy is diagnosed generally just from a history in labs. So there is a classic presentation with it. I just talked about how it's in between the toes and the feet, but the classic presentation is the stocking and glove paresthesia. This is abnormal sensations in your feet up into your ankles, and then the hands and into the forearms and the wrists. Then they look at fasting blood glucose. If it is above 126 or the HbA1c over 6.5, they will give you the diagnosis of diabetic neuropathy. Sometimes your doctor will do a skin biopsy, which is looking at small nerve fibers. Sometimes they'll do a nerve conduction study, which is looking more at large nerve fiber neuropathy. But generally, most diabetic neuropathy is diagnosed just from your labs and your clinical presentation. So some of the symptoms of diabetes are excessive thirst, excessive hunger, and excessive urination. Diabetic neuropathy is defined as the presence of symptoms and/or signs of peripheral nerve dysfunction in people with diabetes after the exclusion of other causes. High blood glucose will damage the small blood vessels that feed the nerves. When these vessels are damaged, our nutrients and oxygen no longer reach the nerve and will eventually cause this nerve to be damaged and eventually die. High blood glucose also damages the outer protective layer of the nerves, the myelin sheath, which affects its ability to transmit signals. This will result in incorrect signals being sent to the brain, causing chronic pain. This is a picture of a healthy nerve and blood vessel and nerves that have been damaged by diabetic peripheral neuropathy. So you can see when they're damaged, you're just not getting the blood supply to the nerves. This can create and damage the myelinated nerve fiber, the large nerve fiber, as well as the unmyelinated small nerve fiber, the C fibers. There's another picture just of how interwoven the blood vessels are with the nerve, and as the blood vessels become more diseased, it's not bringing the nutrients or oxygen to the nerve, and eventually the nerve will shrivel up, affecting its ability to transmit signals. So HbA1c, we've talked about a little bit. Let's describe what it really is and what it measures. So when glucose can't get into the cell due to insulin resistance at the receptor sites, free radicals will attack it, and then we get this glycosylated end product. This is basically what we measure with the HbA1c. It's the end product at the red blood cell. And it's usually over a 3-month period because red blood cells have a shelf life of 3 months. So this glycosylated end product is much more inflammatory, and it actually creates more damage to the blood vessels and the nerves. The nutrients and oxygen, like we talked about, can no longer reach the nerve and will cause the nerves to be damaged and die and affect the communication ability to transmit signals. It also affects the myelin sheath, and this will oftentimes result in chronic pain with the inability for it to transmit signals properly. So these glycosyl end products actually turn on the inflammatory cascade. So it begins to affect the mitochondria. We call it uncoupling of the mitochondria, which causes the sodium not to be pushed out of the cell. So within each cell, the mitochondria is the powerhouse. It's what produces what we call ATP, and there's a sodium and potassium pump that's working nonstop. When we're unable to push the sodium out, this will bring the nerves closer to threshold, and these C fibers will then spontaneous fire, and this can cause pain or burning. Other things that can cause or affect the uncoupling of mitochondria and affect our resting membrane potential is lack of oxygen. So this can be from anemia or poor circulation, blood sugar issues, which we've talked about from diabetes or insulin resistance. Sometimes lack of activity will decrease the stimulation to the brain, which eventually will affect our mitochondria and affect that resting membrane potential. And then oxidative stress from inflammation, autoimmunity, or environmental toxins. So issues like chemical sensitivity. Sometimes with some people it's radiation, heavy metal toxicity. You can have exposure to things like DDT, Agent Orange, viruses, bacteria, parasites, limes. There's so many different things. That's why you need a doctor that's going to look at the potential causes and just not put you in this category that you have peripheral neuropathy. So when any of these happen, this will create that unhealthy mitochondria. And the mitochondria is super important for producing energy of the cell. It's our powerhouse. And when production will go down, fatigue goes up. It'll also affect brain endurance. And then we talked about that sodium-potassium pump. So if we're having trouble getting sodium out of the cell, our nerves get closer to threshold. So we become more sensitive to things. As this threshold, it doesn't take a lot for it to be stimulated. So you can have chronic pain. You can have things like ringing in the ear, tinnitus. You can have fatigue, nausea with car rides, more sensitive to sound and light. These are all brain endurance issues coming from that uncoupling of the mitochondria, that sodium-potassium pump. It will also destroy the large nerve fibers, the A fibers, and the small nerve fibers, which are the C fibers, pain and temperature. The A fibers are more about proprioception and balance. And then it can affect the autonomics. So if you're not getting nutrients to the blood vessels are what feeds the nerve, and you can start to have circulation issues, which can cause an array of symptoms throughout the body. And you can see here on this diagram that I have, the viscera is basically the gut, and it can affect the motor. So the ventral horn is the motor part that goes to the skeletal muscles. It can affect the skin, so that can cause things like excessive sweating. There's just a lot of things that can happen once you get that autonomic neuropathy and the blood vessels get affected. So neuroplasticity is that over time pathways can become more efficient. So if you have a pain pathway that's become more efficient, you're going to have pain all the time. So what you need to do is change the neuroplasticity. Now in 1980s, they discovered that the brain can change. So neuroplasticity started to become a real hot topic. Now, you can do various exercises, what I call activation, that can help stimulate the brain. And it could be good or bad. So neuroplasticity, if you continue to do the patterns and behaviors that are not good, then obviously these pathways become more efficient. So like we talked about the pain pathway or other pathways, or we can make positive change and start to develop new neuronal pathways. That's why a person or an individual that has had a stroke, they'll start doing techniques like mirror therapy with them, where they're looking at their opposite limb working, and they'll start to develop new pathways to that the limb that's actually been affected. So there's a lot of techniques that you can do to start to change the brain and the way that it interprets pain and function. So there is really no cure for diabetic neuropathy. So there is for sure support that you can do to improve your symptoms. Now, the most important thing you have to do is control blood sugar, make sure your oxygen is good, so we're getting good circulation to the tissues, so no more damage happens. And then we can do the things we talked about, the neuroplastic activation, as well as looking at other causes. So we talked about the environmental toxins that could be affecting the mitochondria. So really, it's usually just not the glucose. There's usually other issues involved. So when people try different techniques and they go, oh, that's just not working for me, it's because some of the time they just haven't figured out what the cause is. So you need to get rid of that, whatever that toxic agent is, control the blood sugar, start to exercise, and then perhaps you can start to note symptomatic improvement. So the longer you have the issue, the more damage is going to occur and the harder it's going to be to change. There are a lot of medications that are prescribed for diabetic neuropathy. So you have your different anticonvulsants, you have your opioids, you have your SNRIs, your antidepressants, and these are all great to help minimize your symptoms and to exhibit improvement, hopefully. But truth, the best remedy is still to control your blood sugar. So oftentimes in my practice, or if I consult with somebody, they're super excited that they're taking metformin or something to control their blood sugar, but their blood sugar is still over 150 at fasting blood glucose, and A1C is still 7.2. And to me, the medications just aren't the cover up. You have to still take control and get those numbers down. So, in my opinion, you'll never improve if you're taking medications and the blood sugar and the HbA1c are still high. You're still going to create damage within those vessels and those nerves. So, diabetic neuropathy can present in a lot of different ways. As I said, it can affect the large nerve fibers, it can affect the small nerve fibers. You can have focal areas of proximal motor neuropathy. You can have just areas along the trunk called acute mononeuropathy. They call it truncal neuropathy. It can affect the cranial nerves 3 and 6, which have to do with different eye movements. It can affect certain things like the median nerve is your carpal tunnel nerve. You can have ulnar nerve entrapment, lateral popliteal nerve entrapment. It can actually affect different single areas of the body due to the inflammation that is caused from the neuropathy. So if you're just typing away all day and you think it's just from repetitive stress, it's the inflammation of the body from the diabetes that's creating now that entrapment of that, perhaps that median nerve, creating the carpal tunnel syndrome. So different types of diabetic neuropathy include peripheral neuropathy, focal neuropathy, autonomic neuropathy, and proximal neuropathy. Most commonly, it'll cause burning, tingling, numbness of the feet and lower legs. And as I said, the diagnosis of diabetic neuropathy is usually by history, labs, and a clinical exam. The symptoms can be vast. That's why it's so hard to diagnose. You can have muscle issues, you can have sensory issues like pain or numbness or cramping. You can have the autonomic symptoms like we talked about, the cardiovascular, which can affect fatigue and dizziness, lightheadedness. It can affect the GI system, causing bloating, constipation, diarrhea, vomiting. You can have symptoms to the urinary tract, having more infections, erectile dysfunction. It can affect the sweat glands, where you can actually have more hair loss or dry skin, or actually increase sweating. And it can also affect other things like depression, anxiety, it can affect your sleep, and definitely cognitive changes as well as the brain fog. So the symptoms are vast. That's what makes it super hard to diagnose when you go to a doctor. I should say super hard to develop a good treatment plan for you. So the evaluation is a few things. So you want to just inspect and look at the coloring and skin changes and swelling. Look to see if there's any hammer toes or high arches. We palpate, just make sure the temperature is normal and the circulation is good, so the capillary refill time. We evaluate small nerve fiber and large nerve fiber. So through the pinwheel or vibration sense, we'll do light touch and then hot and cold and balance exercise. So there's a lot of things that you can do on a clinical exam. I posted a video earlier on a neuropathy exam that we do in our office. And if you want, you can look at that to get a little more specific. So sensation, we usually use this monofilament. I'll kind of show you what it looks like in the next slide. Vibration is with a tuning fork. We just put it on the different parts of the body to see if you can actually feel that vibration. And then proprioception is through a pinwheel and or other things, maybe just a pin, just to make sure that you can feel things in the different balance exercises. So I kind of showed the pinwheel and the tuning fork, what it looks like, and the monofilament. This is how we really test for it. It's basically just a little thread that we just touch on different parts of the foot. I usually have the individual close their eyes and they tell me where they're feeling the sensation. I kind of mentioned in my last lecture that if this comes out positive, I let the patient know it's really hard to fix them because then they've lost the myelin fibers. Light touch is a large nerve fiber neuropathy, and once it's lost, it's really hard to regain. We look at gait. So if patient has a broad-based gait, we're looking at more, balance issues, possible issues to a part of the brain called the cerebellum. We're looking at foot drop. We're looking at how, are they shuffling when they walk? Are they not feeling the feet? And then, of course, the labs. We've already talked about the fasting glucose. Ideally, in the functional medicine world, we like it to be 100 to 115. HbA1c below 6 and 5.6 is ideal. There's a test called fructosamine that if you've just started a new program and you want to check your hemoglobin within a 2-week period, you would want to run this test, the fructosamine test, where HbA1c is your blood glucose or that glycosylated end product over a 3-month period. Fructosamine is a little bit faster. We'll do tests looking at different vitamins, B12, folate, B6, magnesium, and then we'll do insulin and C-peptide to evaluate how your cells within the pancreas are actually producing insulin. And there's advanced testing. So there's something I'll test for an autoimmunity. It's called the GAD65 antibodies. So if I'm seeing the broad-based gait, if I'm seeing signs that somebody has autoimmune issues or potential autoimmune issues, I will run the GAD65 antibody test. They are antibodies that are positive for the pancreas, which produces the insulin, as well as the cerebellum, which controls our balance and our gait. So metabolic syndrome and insulin resistance is oftentimes real difficult to fix once you get into that metabolic syndrome range. And so metabolic syndrome is when your glucose is really greater than 100, triglycerides are high, cholesterols are high, LDL is high, HDL is low, and perhaps your uric acid is high, or triglycerides are greater than your total cholesterol. This means your body is in this metabolic syndrome, which you really need to give it a good kick, a good jump start to get you out of this syndrome. Otherwise, it's really hard to get your glucose down and to start to lose weight. So the first thing is you got to obviously control the diet and the amount of fats that you're putting in and the trans fat and fried foods. Footwear is super important. It has to be comfortable and not too tight. I have patients that just come in, their whole neuropathy issue is just from their shoes are so tight, they're actually compressing the nerves, creating this neuropathy type symptom and irritation of the nerves. So as far as support, the key things are you want to do some dietary restrictions. So we recommend either a ketogenic or paleo diet. There's a lot of diets out there, and your goals are really restrict sugar and kind of avoid the processed foods. Take a look at the hidden sugars that are put in all these foods. And some things that you think are healthy, they have 13, 16 grams of sugar, and that just can't be so healthy for you. So just because it says gluten-free, it doesn't mean it's sugar-free. You want to try to keep your veggies to fruit at a 3-to-1 ratio and then eat fiber. Exercise has been proven through numerous studies to help with insulin receptor sensitivity. And I'm often asked, what is the best type? And I always say the best type is the one that you're going to do. So if it's swimming, walking, weight training, if you have troubles moving because you're confined to a wheelchair or walker, then exercise with your arms. They have upper body ergometers. Exercise is exercise. And as you start to improve, maybe it will improve the symptoms of your legs where all of a sudden you won't need the walker and or the wheelchair at one point in time. Ideally, you want to do 20 minutes, but start slow. The key is you want to continue. So if 5 minutes is good, start with 5 minutes. Try to get yourself up to 20 to 30 minutes per day, and ideally 5 to 6 days per week. The ideal heart range, you want to go 180 minus your age. So if you are 65, 180 minus 65 is 115. That's your ideal heart rate while you exercise. There are a lot of supplements that have been proven and tested through research that help with insulin receptor sites and to help lower blood sugar. I'm just going to name a few that have been researched. I'm not promoting any of these. I do think they all help. I use combinations of them with my patients depending on what else I find. I want to stress to you there is not one protocol that is going to be the protocol that's going to work for everybody. I know certain people, they've had great success, they want to share it, and I think that's a wonderful thing, but everybody is slightly different. So alpha-lipoic acid, B12, chromium, berberine, B1, bitter melon, biotin, fish oils, acetyl L-carnitine, CoQ10, to support deficiencies such as D, C, and I already mentioned B12 and alpha tocopherol. These are all like supplements that have been researched and found to be effective. We have a product that I actually private labeled that has a lot of these in it. I recommend this product to my patients, but to be honest, it's not for everybody, so I don't recommend it to everybody. The slide on the bottom, I just love it. The caption is the perfect anti-inflammatory diet. So, ice with a knife and a fork. Sometimes it feels like we have to cut everything out of our diet to start to improve. And the key is you have to decrease your systemic inflammation. If you don't decrease the inflammation in the body, even if you control your blood sugar and don't control the other factors that might be creating inflammation, you're going to still have issues. So if you have diabetes and you're doing repetitive stress, it's going to affect certain nerves, certain muscles, certain joints. So if you've ever had a treatment done and you flare up, so I know patients, they've had, let's say, acupuncture or a massage, and they feel like every single needle really hurt. And then you'll have the next patient that says, I didn't feel it at all. Well, if the needle's hurting, it's probably due to a systemic inflammation issue. It's just not that your pain is more sensitive. Your body is more sensitive due to the inflammation. So figure out where the inflammation is coming from, and you'll start to improve. So a couple supplements that I recommend, again, in certain combinations, depending on the patient. These are all been tested through research, is curcumin, resveratrol, pine bark extract, boswellia, certain antioxidants, alpha-lipoic acid, CoQ10, vitamin C, and I also like glutathione, which is our body's major antioxidant. For the mitochondria, I talked about that uncoupling, that sodium-potassium pump, and how important it is for energy. So even if you get the inflammation reduced and the diabetes is under control, if the mitochondria in your cell membrane is an issue, it needs support. So that's why I like the CoQ10, the alpha-lipoic acid, magnesium, carnitine. And there's something called PQQ that I really like a lot that helps support the mitochondria. But if you just choose one, to me it's like taking a dart and hoping it sticks. That's why some of you have tried different things and you're, that just doesn't work, is because there has to be an overall plan. And the plan needs to be kind of broad-based. It has to be widespread. You have to control diet, you have to give your body the proper nutrients, and you have to control the inflammation. So some foundational support that I believe that everybody should be on is D3. If your levels are not between 50 and 80, and most patients that I see, and I live in California, their numbers are 30 or below. A good fish oil, there's a lot of different types. Probiotics are really important because most inflammation and most issues with the brain start in the gut. But you want to switch these every few months because probiotics would become, we call it monocolonized. They become too dominant. So switch it out every so often. And if you're really not healthy, do a really powerful one in the beginning, and then you can tailor it to something that's a little less expensive and maybe not quite as powerful. And then curcumin and resveratrol, or I would say curcumin is one of my foundational support products. So type 2 diabetes is reversible. It's been proven. So you need a controlled diet, exercise, measure your levels. So, can we reverse the neuropathy? No. Can we protect it? Yes. Can we support it? Yes. We've talked about how we do this. Stabilize blood sugar, good antioxidants, in my opinion, liver, gut, nerve support, and exercise. I want to thank you so much for listening. I hope you learned something from this presentation.